this session is really going to be addressing care planning. So the title of our session today is, from care plan to practice, delivering CHW services that meet members' needs. So I'll just breeze through these next few slides. These are just introducing Community Health Synergy. I know most of you have already met us. And again, we've been working with LGBTQ TA Center to provide, the training and TA around the CHW benefit. And then with these grantees that have been really kind of supporting that work. So, just to, provide a little bit of a review in terms of what we've covered already. So, for this group, we've already gone over the first 3 modules about contracting, CHW qualifications and training, and the referrals and outreach, which, kind of covered that standing recommendation as well. So today we're going to go ahead and focus on module 4, which is on service delivery and care plan development. So in this learning collaborative session, we're hoping that, we can share how to develop that and implement care plans that guide CHW service delivery under the DHCF CHW Medi-Cal services benefit. So in this session, I'll introduce 2 practical tools. So one is a care plan template to ensure person-centered care. And then I'll show you a CHW services crosswalk that we sometimes provide to folks. And that will, kind of give you and your teams a sense of, how to link member goals with billable CHW services. So, to start, I'll walk you through kind of this, ongoing case study, that we used from the last session to really help exemplify how care plan development could apply to a hypothetical client you might encounter. And then we'll go ahead and walk through those 4 billable CHW services. So you can crosswalk how your existing services align with, what's billable through the CHW benefit. So from our last session, you may recall a case study about Ms. Martinez. So just to kind of review what we last covered, so imagine Ms. Martinez is your client and you or your CHW identified that she presented with anxiety and depression risk from her, experience of discrimination that she received when accessing healthcare. And as someone who identifies as a trans woman, you found that she needs navigation to gender-affirming care and integrated mental health services. So given that she met that eligibility criteria for the CHW benefit, again, thanks to that standing recommendation policy, which is, that authorization to provide CHW services, without that need for authorization by a licensed provider. So in this scenario, the CHW explained what support is and what's available to Ms. Martinez, who is grateful and agrees to ongoing CHW support from your organization. Now that she's agreed to engage with your CHW program, let's go to the next. So imagine that Ms. Martinez has self-administered the PHQ-9 depression screening, and your CHW sees that her score, signifies moderately severe depression. And this presents an opportunity to further assess her needs and develop a care plan. So in that care plan, this could, include assistance for helping her navigate gender-affirming primary care services for hormone therapy restart, also referring her to a trans-affirming therapist, connecting her to safer sex supplies, HIV, STI testing, and PrEP services. Also accompanying Ms. Martinez to her first medical appointment for advocacy and support. And then, maybe even perhaps linking her to housing assistance, peer support groups, and community resources. So let's talk a little bit about, what's entailed in developing a care plan. And, you can ask yourselves, what do you are, and maybe your teams already have in place to develop, a care plan for a client. So here, just to, just lay this out, a little bit briefly, the CHW can draft the treatment plan, working closest with the member. And, this, can be ideal because, the licensed provider may not have the time to articulate the treatment plan. So the care plan development process, again, can ideally be led by the CHW. Or they can also, assist with developing the treatment or care plan to identify supports and services. They can also draft the plan, which is then reviewed and approved by the licensed provider. The final version of this care plan, it should be shared with the supervising provider, your organization, and then the licensed provider at the initiating visit. So I want to share, this screenshot of a care plan template. And, this is something that, you can also, take a closer look at when we share the slides out. But, this care plan template here was sourced from, a managed care plan that we've worked with. This is Santa Clara Family Health Plan. So here you can see the key components. So the name, date of birth, identification number, when services started, the conditions being addressed with CHW services, and then who the care team members are. So here you can document, specific health objectives, what's needed, who's involved, and the frequency and duration of those objectives. So you'll see a list, kind of in the bottom, like of all of the qualifying licensed providers who can sign off on the care plan. And you document the provider name, email signature, and the effective date of the care plan. So keep in mind here that care plan effective date doesn't have to be before the 12 units of service. But if you wish to activate the care plan immediately, you can. Some objectives, that you could include here include, some of the language that we had discussed earlier. So, teaching depression awareness as health education, perhaps, connecting Ms. Martinez to a trans-affirming behavioral health provider as health navigation, and accompanying Ms. Martinez to her medical appointment as, individual support and advocacy. I would document these in the objective boxes and then, specify the frequency and duration of those visits. For the bottom part of the care plan, for example, if you have an in-house licensed clinical social worker, you can check that off. But, maybe you don't have a licensed provider in-house, but you're, partnering with a nurse practitioner at a local FQHC, a clinic, private practice, or a hospital. So, you can be partnering informally or formally, so, via an MOU. So that nurse practitioner could be a paid employee or a volunteer as long as they can provide proof that they are a practitioner of the healing arts. And then they can go ahead and sign off. So the key elements of a care plan include, again, assessing the client's strengths and risks, priorities and goals, and documenting realistic and achievable actions to meet those goals. So you document the key issues discussed and decisions made by the client. We also recommend documenting referrals to resources the client is clearly interested in, health and social care services, follow-up plans, and whether you've closed the loop regarding access to those services. So many managed care plans really care about, closing care gaps and closed loop referrals so clients aren't left hanging after a referral. So, here you also would document ending care management services when the client wishes or when they have gained the necessary skills, resources, and confidence to manage, their own life and health challenges. So the next and kind of like the conclusion of this training is really about the CHW services. So we've talked about contracting, we've talked about workflows from claim submission to reimbursement. We've talked about the standing recommendation policy and then now the care plan. So, there are many components of this benefit. So we'll just kind of revisit what the CHW services are and then, do just a little of a deeper dive. So, CHW services include four large buckets of services, really, which include health education, which is really focused on promoting a member's health or addressing barriers to physical and mental care, mental health care. So, including providing information and instruction on health topics. Health navigation, that's really focused on providing, information, training, referrals, or supports to assist members with accessing healthcare and connecting to community resources. Screening and assessment, which is focused on assisting members to connect to appropriate services to improve their, health and to improve their health. And then individual support and advocacy really focuses on assisting a member in preventing the onset or exacerbation of a health condition or preventing injury or illness. So, some examples of health education, obviously, I think, this is probably a little bit more self-explanatory. So that would be like providing, coaching, maybe to help someone understand, various health topics, including, improving self-management, of like, let's say a chronic disease like diabetes, or addressing barriers to care. Health navigation, again, that's really helping, people access healthcare services or connect to resources. So that could be like, outreach, referrals, support for care or public assistance. Screening and assessment is, conducting the non-clinical screenings and assessments. So again, like, the PHQ-9 that we, used in that case study example would be an example of that. And then individual support or advocacy. So this is offering, personalized peer support, encouragement, or advocacy to prevent or address health conditions, injury, or violence, and really to help, members reach their health goals. So that could be, accompanying a person to their first, to a medical visit. So here's just an example of, a workflow. And this is something that, sometimes managed care plans ask for. They want to see, like how things work in terms of, the process that you follow. So this is just an example from, the four available services. So this one is, addressing the health navigation process workflow. So here, you would conduct initial enrollment and screening in week 1. The action here is conducting intake and screening, and the desired outcome would be that the client is enrolled or referred to the relevant mental health programs. Step 2 is program enrollment. Here you would communicate to your managed care plan that, program enrollment is the next step in health navigation. So the CHW would submit applications and required documents to the appropriate entities and programs, and then follows up with those agencies to confirm receipt of the application. So the outcome here is that, your client is successfully enrolled in the programs. So, there are additional steps that you could outline, but these steps become, those policies, procedures, protocols, and the standard operating procedures that many managed care plans look for. So they just want to see that you have a process in place. So step 3, is preventive services coordination over, weeks 2 to 4. So you would coordinate preventive services for the client and ensure that the client receives appropriate services based on needs and eligibility. So the outcome here is that the client receives the necessary preventive care. And then there's a monitoring and outgoing support phase where you ensure that the client continues to access services. So the outcome here is that the client stays engaged with their health services and maintains eligibility. So this is really, I think, timely service, especially with health navigation, given, HR1 related impacts. So, and then the last two steps of health navigation process relate to enrollment and verification, or enrollment verification and redetermination. So this is, again, like I had mentioned, really important now with new eligibility redetermination rules, where every 6 months you have to prove that you still need Medi-Cal. So again, really timely for the role of a CHW functioning as a navigator, so they can help, the client review their status, ensure that they remain enrolled, and assist with any recertifications, renewals, and reporting of changes. And then the outcome here is that the clients remain enrolled and avoid lapses in services. And then lastly, there is final review and case closure. So when you review the progress of your client, ensure that, all necessary health services have been provided, you can transition the client to another program. So often, people start with a CHW benefit and then go to another Medi-Cal service, such as enhanced care management or community supports, or sometimes it's the reverse. So for example, you might enroll someone to receive, medically tailored meals as a community support. After they receive services and are food secure, but still need ongoing individual support and advocacy, they can get connected to CHW services. Or you might work with someone, experiencing homelessness, who is in enhanced care management. Once they're housed and stable, they can transition to CHW benefit services. So you're identifying where they can continue their care under your coaching, guidance, and support. So here is just it's just an example of an activity that we do with some folks, just to do like a crosswalk of their CHW services. And we would invite you to think about, which of your definitions of the 4 billable services that we described. So, again, the health screening and education, health navigation, and the individual support and advocacy. So maybe use this kind of, graphic as a guide for you to kind of do your own, assessment here. And that can kind of get you to think about, where your services fall in those categories. And then here is just, again, just a workflow in terms of, how this all kind of fits together. So you may need to zoom in on this a little bit later, but, I can just walk you through a little bit. So, our focus today is really kind of more on the front end. So the outreach and referral, and then, again, the service delivery and care and plan development are things that we've discussed today. So, at the top, you'll see how members enter CHW services. So you'll see 2 magenta boxes here. And the first magenta box at the top, kind of shows the 2 referral pathways we had described earlier. So either the MCP assigns you an eligible member, or a licensed provider refers an eligible member directly to you. The second magenta box at the bottom shows the 3rd pathway. So when your CHW proactively identifies an eligible member through outreach in the community. So that's where, we saw in the case study when the CHW met Ms. Martinez at the Pride event. So then moving on to intake. So then the CHW conducts the usual intake process. So then confirming the person is a Medi-Cal member and verifying that they meet the eligibility criteria. So here, we find that, the CHW confirms Ms. Martinez's, eligibility criteria. The purple box is a key reminder. So the standing recommendation policy means that you don't need prior authorization from a licensed provider to begin offering services. However, the CHW must still confirm the member is enrolled in the specific MCP that you're contracting with. So you usually do that by accessing your MCP's provider portal. So of course, if the MCP already referred the member to you, you're all set. So you already know that they're enrolled. Once verified, the CHW can start providing any of the billable services shown in these blue boxes. Um, so for example, Ms. Martinez might need another screening like PHQ-9 to further assess her depression risk. You can also create a care plan early on in the map or early to map out the services you'll provide. So that gives you a clear roadmap. So again, like how many health educations will you offer? What kind of navigation support does Ms. Martinez need? Maybe referrals to other providers, like, a trans-affirming behavioral health care provider. Does she need you to accompany her to a doctor's appointment for added support? So again, we'll dive deep into all of these billable services. But this gives you a preview of kind of the complete workflow from outreach all the way through to billing. And then with that, if you so desire, here is a link to the evaluation. We'd love to see if this has been helpful for you all. This has just been a very general overview. Please do fill this out. And then we've also linked some resources to further answer your questions, and also just to provide kind of more specific and detailed information that, to questions that you might have. But of course, feel free to reach out to our team at Community Health Synergy, and we can help provide additional support and or guidance that fits your needs. And with that, thank you very much for listening, and we hope you have a great rest of your day. Thanks.
Thank you so much, Joanne.
Oh, of course.